Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about the Kinderen Regional Hospital and its impact on community health. Joining me on the program is Dr. Fiaaz Hassan, Medical Superintendent and General Surgeon. Welcome to the program, Dr. Hassan.
Hi, good morning.
We're happy to have you here today. Today we'll be talking about the Kinderen Regional Hospital and its impact on community health. So tell us a little bit about the vision behind this new hospital. I know in this area it's relatively new and members of the community, they're able to access service right in their area. Tell us about this.
So, as you know, Region 3, the population, the healthcare staff, and all of Region 3, long waiting for a facility like the Kinderen Regional
Yes.
Hospital. It's one of the most modern infrastructure. And so the population, the residents, and of course the healthcare staff, the excitement of working in such a facility, you can see it, you can feel it. And coming to the healthcare facility, you can see the joy among healthcare staff, and of course, the comfort patient receive medical care in such a facility. Now, I want to highlight importantly the location of this hospital. If you look at the sub-districts in Region 3, you will see that that district is the most highly populated district. So the hospital was strategically placed there, and I think it was well selected by the government to place the hospital in that location, not just for the district there, but it makes advanced healthcare easier to access for the residents of the main islands, like One, Wakenham, and the riverine communities. And with the new Western Mara Regional Hospital under construction, when these hospitals integrate, I can tell you Region 3 might
Wow.
have one of the best healthcare systems.
Yes.
And of course, we must commend the government for this initiative and for the continued progress, because while there are challenges, these challenges are day to day being resolved and being addressed, and they are not ignored or neglected.
Awesome. Definitely. We thank the government for this great initiative. Tell us a little bit about the services offered at this hospital and some of the speciality as well.
So before I go into the specialties, new to the region are some services that were never offered in the history of healthcare, in public healthcare in Region 3. For example, an ICU. The Western Mara Regional Hospital or the other hospitals never had an ICU. So this is significant improvement to the healthcare in
Yes.
Region 3, because very often we will have a critical patient, perhaps a patient with a medical illness or a patient who had a complex surgery. And one of the major hindrances was this patient had to be transported to the Georgetown Public Hospital. And transporting critical patient has its dangers and risks. So this is a significant improvement to Region 3 healthcare. Additionally, for modern technology and imaging is a CT scan. So previously, we had to send patients to Georgetown Public Hospital to get CT scan. Now imagine transporting a trauma patient
Wow.
to get a CT scan. Now the facility at the Kinderen has a CT scan, 24-hour service, and it's of course free for all Guyanese and non-Guyanese residents or visitors. As you know, the government initiative is to provide
Yes.
healthcare free of cost to any person that visits the facility. Additionally, there are improved advancement in every field. For example, dental services. So the services offered there parallel the services offered at Western Mara Regional Hospital. But in every field or department, there is improvement and advancement. For example, in dental services, there is digital x-ray.
Wow.
And of course, it's a brand new facility, so I can tell you it's a top tier dental services. And a lot of patients commend it, and it's like private healthcare given free to our residents. Take for next example, ENT. The ENT service, we have a endoscopy. So these patients can get a camera study, basically an imaging study of their esophagus, and we will advance it to doing a full upper endoscopy. Optometry, again, advanced equipment, and every other department. Those are the daily outpatient department.
Yeah.
Additionally, our hospital is equipped with dialysis machines. So we haven't started as yet, but we will start soon. Dialysis free for patients. We will start. It's a phased approach. We'll have to cater for inpatient first, and hopefully we can extend it to outpatient or at least the other hospitals because you know the patient burden as well. Like I said, every department there are advancement. In imaging, I mentioned CT scan, but we have ultrasound services. Currently, there is no waiting time. It's same day ultrasound. There
Wow.
is no backlog. Our theater equipped with C-arm, which is a special imaging equipment. So if you do a complex surgery, most times it's used in orthopedic surgery, but they can use in other surgeries. So if you repair a fracture, you can do a specialized X-ray to see if it's repaired well or not. Again, this was only available at Georgetown Public Hospital. It's now available at the Kinderen and also recently available at West Denmark Regional Hospital. So these are big steps. So it's real-time assessment of your surgery, right?
Indeed. Thank you so much, Dr. Hassan. You're telling me about
Uh,
all these great services.
before
And
before you go on, I forgot to mention the clerical and administrative aspect. So patients are entered in a digital database and they are given appointments, right? And if you can see the waiting areas where your name is basically posted on a screen and you can hear the audio calling out the name when it's time for the patients to be seen in the actual clinic. So those the managing and coordination of patients is a big improvement. So we move from calling and shouting for patients to where it's simplified, modern, and of course it's like again it's big significant improvement to the how we coordinate the flow of patients in the hospital itself.
indeed, thank you so much, Dr.
Yeah.
Hassan. With all this new technology and improved technology, what has the patient flow been like at the hospital, and how are patients actually responding to this world-class kind of system that we're pushing here at the new hospital?
So, like I mentioned, residents long waiting for a facility like this. So, in our day-to-day outpatient department and in our emergency department, you're seeing a massive increase of patients. So we've shifted to in Region 3. You know, there's West Denmark Regional Hospital, Lenore Cottage Hospital. There are other health centers. But what we've noticed is that there is now a significant increase in the number of outpatients seen in the Dickensian Regional Hospital. On average, it's 130 patients. The emergency, again, the average is 50 to 60 patients. In the specialty services, those are increasing every week. The specialty clinics are every day. The outpatient clinics are daily. So there is a large amount of patients coming for all services. And I can tell you that we've reached capacity quickly at the hospital. Because at the hospital, while there are challenges, we have managed to start all our services 24 hours um, so far. And you know that in terms of the inpatients, these are semi-private rooms, 5 beds per room. The services in the rooms, you have contracted kitchen services. The cleanliness is top tier. So patient comfort in the rooms and the wards are really improved compared to other hospitals. So sometimes well, I think some of the patients seem to want to remain there.
All right. Thank you so much for sharing with us, Dr. Hassan. We're going to go into a short break and be right back. talking about the Kinderen Regional Hospital and its impact on community health. With me is Dr. Hassan. Dr. Hassan, you were able to tell us about all the wonderful services of this new hospital, but tell us, how does the design of this hospital differ from other hospitals?
So if you visit, I mean, I encourage all residents to visit the hospital. You can see, I mean, the design is completely different from what we are accustomed to. So the emergency department is nearby to the outpatient department, which is the ideal scenario because patients coming in, if they're not triaged properly, a critical patient or a patient who requires urgent care can end up at the outpatient. So these the departments are nearby, they're parallel. Additionally, next to the emergency room, in the emergency room actually, there is a critical bay. So a patient with high index trauma or a critical patient, maybe let's say a heart attack, they can go to a critical bay, which is a specialized room with all the equipment and instruments you need for to resuscitate or to manage a critical patient in that room. Adjacent to that room is an emergency operating theater. As you know, in other hospitals, the theater are far away, and you have to basically move those patients. So let's say in real time now, a critical trauma patient comes in, they go to the critical bay, and from the critical bay, you go right next door to
Easy
the
access.
operating theater. So this, of course, is improved efficiency,
Yeah.
and in these cases, every minute is an increased chance of survival.
Yes.
All right. To the back of this, next to the emergency room house is a laboratory, right? So if you need to process urgent samples, you need to cross-match blood, it's right there. Next to, behind the emergency room is a imaging suite. So CT scan, ultrasound, X-rays, and the wards are all the way to the back. Now, additionally, the theater. So we have the emergency room theater downstairs, and upstairs we have two theater. One is close to the maternity suite. So the delivery room, the labor room, it has a theater adjacent to it. So let's say a mother in labor requiring urgent cesarean, they just pushed across to the theater and they can receive the cesarean. And there's a next theater there as well, which will be doing elective surgeries. In that same area, the sterile area, is the ICU. So it's a very, I mean, very thought of design, um, and it's all aimed at improving the efficiency and the better coordination of the flow in which we manage patients. It is the ideal design for improved efficiency. Um, there were some minor adjustments we made, and those were basically accepted and expected. Um, the services we have pediatrics, general surgery, internal medicine, obstetrics and maternal, and gynecology. You also have the ears, nose, and throat doctors, optometry, audiology, dermatology,
A wide
dental
variety.
services, a wide variety of services. Additionally, we hope to collaborate with other hospitals and other specialists to start subspecialty services, for example, cardiology clinic, a nephrology clinic, and so on. Those will come in the near future as we expand services at the hospital.
As the hospital continue to grow and improve, I know that training would be essential. Are there plans to carry out any training activities for staff currently at the facility?
Yeah, so there are multiple plans to have training. Of course, the first one is on-site training,
Yes.
continuous training, where the senior doctors will train the junior doctors. That's continuous, it will happen all the time. We do have plans to have accredited training, such as the basic life support, advanced life support, trauma team training, and the pediatric advanced life support for both doctors and nurses. All staff, the clinical side and the non-clinical side, will have customer training, customer-oriented training to improve the way we communicate with patients
Yes.
and how we deal with patients. That will also happen. And like I said, there will be on-site training. Addition to the accredited courses, we will be doing our own on-site training, which we see as needed, as the doctors will need. So we will start that soon as well. So we all know that the government has a major plans to overhaul the efficiency of all services.
Yes.
So in the health sector, there will be an overhaul in the supply chain, and that will improve our supplies, the medical supplies, because as you know, the consumption is very rapid, and it has exceeded the anticipated consumption.
Yes.
So there is a major plan to overhaul the medical supply chain, and that you will see improved efficiency in the delivery of medical supplies to the hospital and in the endpoint access by patients.
Have you heard? The Ministry of Health has launched its cervical cancer screening voucher program for women aged 21 to 65. Eligible women can pick up their vouchers at any distribution site in their regions. Each voucher, valued at $8,000, can be used at any of the health facilities listed on the back of the voucher. Cervical cancer caused by persistent HPV infection is the second leading cause of cancer-related deaths among women in Guyana. Early screening is crucial to detect and treat precancerous cells. Early detection saves lives. Ladies, don't hesitate to get screened for cervical cancer today. Your health matters. For more information about this program, call 227-4357 or visit the Ministry of Health's Facebook page. The Ministry of Health has launched its eye testing and spectacles program. This initiative caters for anyone under 18 years of age and persons 50 years and older. Persons requiring an eye test can utilize a voucher valued at $2,000 at any of the opticals listed at the back of the voucher. If a patient requires spectacles, he or she can then uplift another voucher valued at $15,000 to cover the cost of the eyewear. Vouchers are available at various hospitals and health centers in your region. To learn more about this program, call 227-4357 or visit the Ministry of Health's Facebook page. Your eye health is important, so why wait? Get your eyes tested today. Your sight, our vision. Guyana is taking a bold step towards a healthier future. Introducing the Universal Health Voucher valued at $10,000 available to every citizen. This initiative by the government of Guyana gives you the opportunity to access early screening tests for non-communicable diseases like diabetes, hypertension, and cardiovascular conditions, with NCDs accounting for approximately 68% of all deaths in Guyana. Early detection is important. This program represents a $5 billion investment in the health and well-being of our nation, benefiting 500 people across the country. Eligible individuals include children from birth and adults 18 years and above. At the back of the voucher, you'll find a comprehensive list of tests available to you. To locate facilities where you can access these services, simply scan the QR code provided. This will direct you to a list of accredited healthcare providers. Don't hesitate. Visit your nearest health center to uplift your voucher and take charge of your health today. So, Dr. Hassan, we know persons usually wait until something would have occurred or they're really, really ill to then visit their nearest health center or the hospitals. We want to encourage persons to do routine checkups. Share with us, what is your thoughts and what is your encouragement to our listening and viewing audience with regards?
All right, so since it's 6 weeks now since the opening, and we've noticed a large amount of patients would come in requesting a routine checkup, or a patient will come in requesting an ultrasound or a blood test without seeing a doctor, of course. And when you advise them to see a doctor first, some would get upset and so on. So my advice to the population is see a doctor first and get the doctor's advice. So to make this better and to coordinate it better, we will look at having a day allocated for a routine checkup where a patient can just walk in. It's a walk-in clinic, and they can see a general practitioner, and that practitioner, of course, will request studies, do a thorough physical examination, and request studies and imaging studies, laboratory studies, as needed by the age of the patient.
Yes.
And hopefully, with the customer orientation and customer training, patients can understand this better. Because it's very often a patient will walk in and say, I want a CT scan. Right? But these patients need to see a doctor first and get the best advice. Not because these services are free means you can just walk in and get it done. It should be indicated or by a doctor. So there are some sensitive areas, example men's health, where a person might not walk into a clinic or come to the general surgery clinic to have certain studies done. Or let's say some other clinic like STI and so on, STD. So we will explore the option of having some of those sensitive clinics on Saturdays when the hospital is not so busy, and we can have separate areas for patient privacy and confidentiality. I think that alone will improve patients' access, and they might feel more comfortable coming for
Yes.
those on a Saturday or maybe an after hours, after 4, so on. All right, we will explore that option.
All right. Thank you so much, Dr. Hassan, for joining me on the program today. I want to encourage you and your team at the Kinderen Regional Hospital to keep up the good work that you guys have been doing thus far.
You're welcome. And also, we thank the government and the president for the initiative of decentralizing tertiary healthcare, and of course, the Ministry of Health for the support and the continued progress in advancing healthcare in Guyana.
Thank you for staying tuned to the Health Matters program. Remember to stay tuned to our Facebook page for all of your health updates. I'm Alicia Martin saying goodbye for now.